प्लैब 2 पास करने के बाद जीएमसी रजिस्ट्रेशंस लेने में कितना टाइम लगता है सर?
प्लैब 2 एग्जाम, उसके एग्जाम के
सर
बाद 6 वीक्स होते हैं जब आपका रिजल्ट आता है। समटाइम्स 6 to 8 वीक्स भी हो सकते हैं।
क्या मैं प्लैब के फौरन बाद ट्रेनिंग पोजीशंस के लिए अप्लाई कर सकती हूँ?
Majority of international medical graduates they ask this question. It's not going to guarantee you job.
सर ऐसा क्यों होता है कि कुछ डॉक्टर्स प्लैब और जीएमसी रजिस्ट्रेशन लेने के बाद भी जो है वो अपनी कंट्री वापस आ जाते हैं?
This is again, it's a very common question, and majority of the doctors they ask us. I think the first thing is the proper lack of the proper guidance, support, facilities, and the planning.
Okay, sir. Is job hunting after PLAB is more difficult than expected?
Sir, it's very important we plan our journey properly. If I'm applying randomly for the job, it is very hard.
Hi everyone, I am Asma, an executive member of Hype Medical Academy, and you are watching our official podcast. I'm really excited to hosting this. Today's episode is all about the questions जो सबसे ज्यादा पूछे जाते हैं, लेकिन उनके clear answers हमें नहीं मिलते हैं. So Hype Medical Academy is one of that will answer all your questions. I'm sure that all of us have related to the career guidance and medical education in the UK. And to help us with that, we are joined an amazing personality, the highly talented and the deeply experienced, who has been working in the NHS for the past 22 years, Dr. Shakil Malik.
Thank you so much. I'm fine. Thank you. Thank you so much for hosting this amazing episode for the international medical graduates. Thank you.
Sir, मेरे पास यहाँ पे कुछ questions हैं जो बहुत common है और बहुत ज्यादा पूछे जाते हैं, लेकिन हमारे पास उनके आंसर्स नहीं होते, आंसर्स होते नहीं है या हमें मिलते नहीं है। ये आज हम इस पॉडकास्ट में क्लियर करेंगे।
That's fine. Perfect. We're here to answer all the questions, which could be the potential or possible questions of any international medical graduate who are looking for a beautiful career in the NHS. So please go ahead.
थैंक यू सर। सर तो हमारा पास पहला क्वेश्चन है, प्लैब 2 पास करने के बाद जीएमसी रजिस्ट्रेशंस लेने में कितना टाइम लगता है सर?
प्लैब 2 एग्जाम जो मैनचेस्टर में होता है, सिर्फ यूके में, उसके एग्जाम के
सर
बाद 6 वीक्स होते हैं जब आपका रिजल्ट आता है। समटाइम्स 6 to 8 वीक्स भी हो सकते हैं। सो 6 to 8 वीक्स के बाद जब आपका रिजल्ट आता है, देन यू सबमिट योर जीएमसी एप्लीकेशन। जीएमसी एप्लीकेशन अगर आपके सारे डॉक्यूमेंट्स करेक्ट हैं, आपने प्रॉपरली कंप्लीट किए हैं, आपका कोई गैप नहीं है आपके सीवी में, आपके करियर में, देयर इज नो अदर आउटस्टैंडिंग क्वेश्चंस, so you will get your GMC registration within 24 to 48 hours or sometimes week भी लग सकता है। usually 24 to 48 hours में GMC की रजिस्ट्रेशन मिल जाती है।
ओके सर, थैंक यू सो मच। सर मेरा नेक्स्ट क्वेश्चन ये है, क्या मैं प्लैब के फौरन बाद ट्रेनिंग पोजीशंस के लिए अप्लाई कर सकती हूँ?
Majority of international medical graduates they ask this question. So I just want to clarify. Passing PLAB is just another certificate, another exam, another test, another piece of paper. It's not going to guarantee you job, not going to guarantee you that you're going to get into the training post. Applying for the training post, the UK training system is slightly different. Anybody who is a fresh graduate with no previous experience either in their country or in the local in NHS, they will be applying for the foundation program. Foundation program is equal to, like previously it's called the house job, PRHO and SHO. So foundation program is of 2 years, FI1 year 1, where they will have the 4 different rotations and different specialties, and they will have again they will have FI2. They will have the 3. I think it's the 3 rotations, 4 months each in FI1, and they have the 3 rotations FI2. These are the foundation program. After foundation program, that will give them an idea, taste, and exposure of all the specialties, and they will know better. They will be in far better position what sort of specialty they should apply for the training. So the training post for all the specialties, they are announced nationwide once in a year, and there are open interviews, open merit system. They apply for them, they get the test, and then go to their specialty. Like for medicine, they have to apply for the ST specialty training, IMT training, internal medicine training program. That training starts from ST1 to ST7. There will be SHO, then senior SHO, there will be registrar, senior registrar, and then the consultant. Finally, they have to do the CCT, certificate for completion of training, and they will complete their training. So depending upon what sort of where you are at your career, if you're a fresh graduate, you must apply for the foundation program. But if you have got that several years of experience, like you have, you graduated 10 years, 15 years before, you have completed those, then you can apply for the training post if you want to go into medicine, surgery, or anything ST levels. You can go for the non-training post. There are the non-training posts. You can apply for the junior clinical fellow, senior clinical fellow, or trust grade post. So there's opportunity and option for everyone at every stage of their career.
ओके थैंक यू सो मच सर। अच्छा सर, ऐसा क्यों होता है कि कुछ डॉक्टर्स प्लैब और जीएमसी रजिस्ट्रेशन लेने के बाद भी जो है वो अपनी कंट्री वापस आ जाते हैं?
Haji, this is again is a very, very common question, and majority for the doctors they ask us that I have got the GMC registration, I came back, and now I think the first thing is the proper lack of the proper guidance, support, facilities, and the planning. When they come for the PLAB 2, they should have planned their program properly. They will take the PLAB 2 exam. After training, they will have 6 weeks for the results, and they will have 6 months visa. So these 6 months are very crucial. They must plan and strategize all these 6 months to secure a job. What they have to do after they will have the 6 weeks for the post-PLAB. Once they have taken the exam, they have 6 weeks waiting for the results. During these 6 weeks, they must secure their clinical attachment. Their CV should be top-notch according to NHS template. They should create job profile. They should do some CBD courses, ALS courses, BLS courses, and they should have the mock interview practices. These are the very important things. But unfortunately, majority of the doctors, they are not aware of their lack of guidance and support. What they do, they think, okay, we have passed the PLAB. Once we'll get the result, we'll apply for GMC registration, we'll get the job. It does not work that way. They must have all those things which are very important to secure a job, and they should stand, these things, they will stand them out. Especially the doctors coming from Pakistan. What they do, either they have got some job there or there are other reasons. They take the PLAB 2 exam and they go back without knowing the facts. And when they keep applying jobs from Pakistan, they don't get job because Pakistan is in red list because of the code of practice. So what it means, any doctor who has got GMC registration license to practice, but he's gone back to Pakistan, no employer could legally offer them job because of code of practice. So I would say they don't get job because of these things. Their CV is not good. They have no clinical attachment experience. They have no local references. They know CBD courses. They know have interview practices. All these things they are very important. So all the prep doctors they must consider these things, and these are very crucial to help them to secure a job and to they will stand them out in the crowd.
Okay sir, is job hunting after PLAB is more difficult than expected?
Job hunting after PLAB, again, I said, is very important. We plan our journey properly. If we know which specialty I'm capable of, I will apply that specialty. If I'm not aware that my capabilities, according to my CV, according to my qualification, my experience, skills, if I'm applying randomly for the job, it is very hard. And if you don't have proper guidance from the people who have been in the system for the decades, and you don't know which specialty I should apply, where should I apply, how to apply, what should be my covering letter should be like, look like, what should be my personal statement, what are the specialty, which specialty I should get attachment, where I like to work for next. So if you don't know all these things, it will make it very hard to find a job and secure a job.
Sir, how expensive is life in the UK compared to earning?
For the doctors, if you say it is not expensive, doctors, if they're junior doctors, even their starting pay starts from 36,000 pound per year. And if they want to work some extra locums, they are from 40 to 60 pound per hour. And all their educational expenses, even they're spending for the PLAB journey, or their expenses, they are fully refundable or claim back, they will get back. So they could have a very good life. It's not as compared to what they're earning doctors. They have a very good life, and they could have very good saving. Before PLAB, during the PLAB journey, they're coming, we help them to spend less money because here comes the planning, especially our global medics and NHS program that will help them while they're looking for the job. They could save money, like we find them the good and cheap accommodation. We help them to save money in other things. And once they're in the NHS, they will be making good amount of money as compared to their own country.
सर सर क्या मुझे प्लैब की तरफ जाने के बजाय एमआर सीपी या एमआरसीएस या स्पेशलिस्ट रजिस्ट्रेशन की डायरेक्ट स्पेशलिस्ट रजिस्ट्रेशन की तरफ गौर करना चाहिए?
All these specialties are very good. Depending upon if somebody is interested, go for the MRCP, MRCS. But the best, cheapest, quickest route is the PLAB. Because once you have got the PLAB, you secure your job, get into the system, and get into the training system. So everything will be paid. Like, you're going for the medical training, you will have your education supervisor, you have clinical supervisor, you'll be going through the ladders ST1 to ST7, do your CCT, become a consultant. But if you want to go the different route, like you want to do or MRCP, first what you have to do, obviously you need to start applying and while you are in your country. Right, you will start applying for your exams. You'll be spending money from your pocket. You'll be spending, it will take 1 or 2 years. So instead, if you come through the PLAB route, pass your PLAB exam, get GMC registration, and get everything paid, all your courses, study leave, all annual leave, everything will be paid. Second most important thing, once you complete your MRCP, MRCS, all those, still after that, you have to apply for the GMC registration. So rather than spending 2 years preparing for exams in your country, then coming back and applying for the GMC registration through exemption route is far better and easy and cheaper. Get your PLAB done, get a job, get into the training, and complete your training in the UK.
ओके राइट सर। सर एक लास्ट क्वेश्चन है मेरा आपसे, क्या आयरलैंड, ऑस्ट्रेलिया या गल्फ के कंट्रीज जाना इससे बेहतर ऑप्शन है?
Uh, there are good opportunities in the Gulf
हेलो।
as well, but as compared to the UK, I think UK is far better because I'm aware of several doctors who have been to Middle East countries. After working a couple of years there, they came back to UK because it's better life, better opportunities, and especially for the if somebody has got a family, they have got children, university schools are the far better in the UK. So yeah, if somebody definitely want to go, I would say they should come to the UK, get their training done, and complete their CCT, and after that they could go to the Middle East and work there, and their pay will be far better after with the UK skills experience in the Middle East as compared to their coming from their home country and working in Middle East. So best option is the UK. Get the training, complete your CCT, and then you can go anywhere in the world.
थैंक यू सो मच सर। आई होप कि ये क्वेश्चंस के आंसर्स हमें क्लियर हो गए हैं, और ये इंशाल्लाह दूसरों को भी क्लियर हो जाएंगे। सर थैंक यू सो मच फॉर द टाइम।
That's the player. It's good. And we would say that if anybody needs some more information, we have a Global Medics NHS program, and they could go on our website, hivemedicalacademy.com, and click on the link and get more information. And we'll have some more episodes coming of our podcast where we'll be answering all those questions if anybody has got any further questions. Thank you so much, Asma, for holding this.